Nursing care of patient after above-knee amputation. So while giving post-operative nursing care involves, we start with the routine observation and we will control the pain, positioning the patient, and we will teach the exercise, and we have to observe the stump conditioning and patient education. And the patient education should be done in conjunction with all nursing interventions. So whatever the procedure we are doing for the patient, we have to explain the procedure and we have to make sure, and we should reassure the patient by showing other patient who had undergone the same condition. And monitor the patient vital signs, mainly temperature, pulse, and blood pressure, and the patient will be connected to the cardiac monitor. Here you can see the cardiac monitor, so the pulse oximeter connected, and the ECG recording, blood pressure, everything is recorded in the pulse oximeter. And we should also observe the bulky dressing, whether there is any indication of hemorrhage, or if there is any elevation of temperature may indicate there is a presence of infection at the wound site. And we should check the stump dressing regularly. So because if there is any bloody drainage, that should be marked and it should be documented with the date and time, and if there is any excessive bleeding, and it should be immediately reported to the physician. And check the proximal end of the stump dressing for swelling. The dressings are applied to provide some compression of the stump, but a dressing that is too tight may cause ischemia, because if you are applying the stump dressing too tight, it will cause a reduced blood supply to the particular area, which further leads to ischemia at the stump end. And main thing we have to observe for pain. Pain medication may be required for several days. Initially for at least 5 to 10 days the patient may depend on the pain medications, because severe pain the person may be experiencing. And some patients experience a phenomenon known as phantom pain or a phantom sensation. So this phantom pain is actually the part no longer will be there, but actually the patient may be feeling that the patient is having the pain at the lower limb. And maintain the prescribed position is important, and depending upon the type of procedure used, the extremity may be we have to apply splint in traction, or that extremity should be elevated by pillows, and proper positioning will prevent contracture of the involved muscles. And we should encourage prescribed exercise to preserve the range of motion in the affected limb, and it also helps to strengthen the remaining lymph. And remove and reapply the bandage, and when you are observing, you will be knowing the type of healing, whether it started healing or what, when daily observing the wound. And if the wound started healed, the stump must be conditioned and shaped for the proper fitting of processes. So after healing of the wound, we have to plan for further processes. A special bandaging technique is used to string and mold the stump to a smooth conical shape. So while doing the shaping process, the bandage should be worn day and night. So we should insist the patient at the time of shaping process, the patient has to keep the bandage whole day and night. It is customarily removed and reapplied twice daily or as ordered by the physician. And there are different methods are employed in wrapping the bandage. But if you are seeing the objective, it will be same. And to provide equal firm compression to the stump, a crisscross or spiral pattern is used to avoid constricting the stump and interfering with circulation. Thank you.